Talking about cancer is quite a difficult conversation, but it's important for the society to know what is really oral cancer. The categories of the oral cancer are anywhere from T0 to T4. Any ulceration which is taking more than 3 weeks to heal, that is something that we have to be really concerned about and see our doctor or dentist for that. Well, mouth cancer is the cancer of the oral cavity, and this is much more common than we think. Always talking about cancer is quite a difficult conversation. Even as a dentist or as a patient, this is a very difficult and a scary conversation, but it's important for the society to know what is really oral cancer. This is the most common cancer of the head and neck, and according to the recent survey of 2024, nearly 11,000 new cases of oral cancer have been reported in UK itself, and which has been a 133% increase in the mouth cancers in the last 2 decades. So that makes us think that we really have to be aware of the situation and deal with that as early as possible.
What are the causes and risk factors of mouth cancer?
Well, as we all know, first thing that comes to the mind when we talk about the oral cancer is the smoking. So smoking cigarettes, smoking tobacco, even vapes. Having alcohol for a very long duration of time is another predisposing factor for the oral cancer. But the combination of smoking and alcohol is the worst. There's a virus called as HPV virus, what we call as a human papilloma virus, is another thing that can lead to the oral cancer as well. Following an unhealthy lifestyle, not eating enough fiber in your diet, these are another factors which could lead to the oral cancer.
What are the diagnoses of the mouth cancer?
So, well, the first diagnosis of the oral cancer is the examination. Your dentist or your general practitioner, your doctor, will have a thorough look if the ulcer or the area is visible inside your mouth. If it's not visible and if it's somewhere around the nose or somewhere in your throat, they might do a biopsy. They might do aspiration. They follow a fluid aspiration technique where some part of the fluid is taken out from the area and it's going to be sent to the pathologist for the right diagnosis. And they might do an ultrasound scan of your throat. In the further cases of investigation, they may do CT scan or MRI. So these are the basic diagnostic techniques which are used for the diagnosis of oral cancer.
What are the stagings and gradings of mouth cancer?
Well, it could be the categories of the oral cancer or the staging are anywhere from T0 to T4, which says tumor 0 or the tumor 4. So T0 is the most less riskful stage of cancer, and the treatments are more successful. And T4 is the worst stage of the cancer. And then it comes with alphabet M, what we call as metastasis. That means if the oral cancer is spreading to the other parts of the body or other parts of the lymph nodes, then that's categorized or rated as metastasis.
What are the treatments for mouth cancer?
Well, basic treatments for the mouth cancer is the surgery. Then there will be a chemotherapy. There is radiotherapy. There is a chemoradiotherapy where the chemotherapy and the radiotherapy are combined together. But there are some therapeutic therapies as well where the areas around your cancer cells are targeted with the help of medications. But of course, it will purely depend on the stage of the oral cancer and will be a complete planning from your surgeon about how they want to deal with the symptoms as well as with the cancer.
But what about aftercare for mouth cancer?
Well, when we become cancer-free, that's the happiest news we get. But following a proper protocol of the checkups is extremely important. Making some positive lifestyle changes will be quite important. Eating healthy, having an active lifestyle, leaving alcohol and quitting smoking. There are the few changes that we can do in order to make sure that we deal with the symptoms. Having a multidisciplinary approach with a doctor, with a dentist, with your dietitian, with your therapist for some emotional support is extremely important. For the right follow-up with the right planning after you're cancer-free is also very important.
What are the signs and symptoms of mouth cancer?
Well, the signs and symptoms of the mouth cancers are something that we can always ignore. But with the oral cancer, any ulceration which is taking more than 3 weeks to heal, that is something that we have to be really concerned about and see our doctor or dentist for that. Oral cancer can be in any part of the mouth. The most common areas to have the oral cancers are the side of the tongues. Other areas where you can have oral cancer could be the soft palate, the hard palate. It could be on the gums, and it could also be in your tonsils or in the throat. You see sudden mobility in your teeth, and if you see that my mouth is very sensitive to the spices, so all these factors can be related to the early signs of oral cancer.